Good evening, friends. Welcome to my channel. So far, we have discussed about the spotters from the thigh, and we have discussed about the posterior aspect of the thigh, and we have discussed about the gluteal region, and the front of the thigh we have seen. And today we are going to see the back of the leg and anterior compartment of the leg, and also we are going to see the dorsal compartment of the foot, and also we are plantar aspect of the foot. Most probably they doesn't ask in the examination because of this overcrowding of the muscles may confuse the student, so they doesn't go for this plantar aspect of the foot. Rather, they discuss in the practical examination regarding the sole of the foot, so the layers of the sole of the foot. So before going to explore this, please subscribe to my channel. Now we are going to see the back of the thigh, and we are going to see the popliteal fossa. So popliteal fossa is a diamond-shaped space which is present posterior compartment of the knee. Now, what are the questions usually asked in the examination in the spotters? So the first and foremost muscle which usually asked. So already yesterday I have told you about the thighs. We have seen the muscles of the thigh, the muscles of the gluteal region and all. Now we are going to see that posterior aspect of the knee, there is a diamond shaped space called as popliteal fossa. In the popliteal fossa, so what is the muscle present here? Now, so which aspect it is means which side it belongs to this specimen. So try to identify whenever you see this specimen, identify the muscles. How to identify the muscles? So if you find any tendon, so the long tendon, so that tendon it has to present medially. Though, so the tendon is belongs to the semitendinosus muscle. Here you can see the muscle. So this muscle is called as semitendinosus. That semitendinosus muscle it has to present medially. So according to that, we can say that this specimen is belongs to the right side. Right side. So obviously the left side. Obviously the left side we can identify semitendinosus medially, and laterally we can identify the biceps femoris muscle. Let me show you that. So this is the called as biceps femoris muscle, which is getting inserted to the head of the fibula. That it is forming, it is present in the lateral aspect of popliteal fossa. So we can discuss about the boundaries as well. Superolateral boundary is formed by the biceps femoris, and superomedial boundary is formed by semitendinosus, and we can say that semimembranosus, which is present just below that semitendinosus muscle, or deep to the semitendinosus muscle we can identify semimembranosus muscle. So this is semitendinosus, and here you can see that semimembranosus muscle. Yes. Now other muscles, inferior-medially, inferior-laterally. So what are the muscles are present inferior-laterally? It is very easy to write that. So inferior-medially you can identify the gastrocnemius medial head. Inferior-laterally, we can identify gastrocnemius lateral head. Inferior-laterally, gastrocnemius lateral head. Inferior-medially, gastrocnemius medial head. Okay, so these muscles are seen at the posterior aspect of the knee joint. And another muscle, which is very deep muscle, a small part of it we can identify. If that muscle is pointed and asked you, you have to write it as plantaris. So what is the importance of the plantaris, they may ask? So it is also a vestigial muscle. It is also a vestigial muscle in the lower limb. Okay, so that is about the plantaris. Regarding each and every muscle and their clinical aspects, I am going to have another session on this, so you no need to worry. So this is how we have to identify the muscles at the popliteal fossa. Now muscles I have seen. Now what are the structures we can identify here? The nerves. How to discuss, how to identify the nerves. So already you have seen the sciatic nerve, which is present at the back of the thigh. So just it is coming out and entering into the back of the thigh through the greater sciatic foramina. Then it is running below the piriformis, then extends into the back of the thigh, then it is going to bifurcate, That is, medially you can identify the tibial nerve and laterally common peroneal nerve. So already you might have studied about the course of the sciatic nerve. So you don't need to worry about it and you can easily identify it. So the medially we can identify the tibial division of sciatic nerve, and then here you can see that common peroneal division of sciatic nerve. We can write it as common peroneal nerve and tibial nerve. Okay, so medially tibial nerve, laterally common peroneal nerve. How to identify the thickness? The thickness give you an idea, and the common peroneal nerve which is present laterally, tibial nerve is present medially. Okay, if it's the small nerves, they doesn't ask why, because it may give you a confusion, sort of confusion. So they ask the main nerve name only. So this is nothing but the sural nerve. From the tibial nerve a branch comes, from the common peroneal nerve another branch comes. So the two branches joins and forms the sural nerve. That doesn't ask you, but remember this is a sural nerve. Okay, if vein asks in the back of the leg between the two heads of the gastrocnemius, that you can write it as small saphenous vein. Try to identify it if it is a vein. If it is having any lumen, then you can write it as small saphenous vein. Now, what are the other structures? Here you can see that back of the leg. So we have seen the gastrocnemius medial head and lateral head. Underneath this medial head and the lateral head of the gastrocnemius, where we can identify another muscle called as soleus. So what is the clinical importance of the soleus? They may ask in the examination. The question may be asked in the examination. So why it is called as peripheral heart? At least you have to write as one sentence in the spotters. Then moving to the back of the leg. So what are the structures we can identify? So far we have seen the popliteal fossa, back of the thigh, and in the back of the leg or crural region, posterior crural region. What are the questions usually asked? So here you can see that medial head of the gastrocnemius. This is medial head of the gastrocnemius. So which aspect it might be? Which side this specimen belongs to? Try to identify it. So it belongs to the left side specimen. Okay, then here you can see that medial head, lateral head of gastrocnemius, and then here you can see the tendocalcaneus. So this muscle may be pinned, this muscle may be pinned, and this tendocalcaneus may be pinned, pierced, and ask you to identify that particular structure. So gastrocnemius, what they ask is origin insertion. They may ask. If they ask about the tendocalcaneus, which muscles are forming the tendocalcaneus, that the question usually asked in the practical spotters. Now we are moving to the anterior compartment of the leg. So here you can see that tibialis anterior. How to identify the muscles? So here you can see that right side leg. So the medial surface is subcutaneous. So there are no muscles are attached to the medial surface of the tibia. So the anterolateral surface of the tibia, all the muscles are attached to that. So anterolateral surface of the tibia, where we can identify tibialis anterior muscle. Then deep to this tibialis anterior and the extensor muscles, we can identify the deep peroneal nerve, and along with that we can identify anterior tibial artery also. So if the anterior tibial artery extends into the dorsal compartment of the foot, here you can write it as dorsalis pedis artery. Here you can write it as. Okay, so here in the leg region, anterior tibial artery and the deep peroneal nerve. Now, dorsal aspect of the foot. What are the questions usually asked? So here you can see that the lateral compartment of the leg, two muscles are present. One is peroneus longus and peroneus brevis. Superficially, we can identify the peroneus longus, which is extending down and it is passing underneath the two retinaculars called as superior peroneal retinacula and inferior peroneal retinacula. This peroneus longus which runs under the foot, and it is getting inserted to the medial cuneiform bone and also to the second, third, and metacarpals. So you cannot identify clear tendon in the examination on the dorsal aspect of the foot, but you can see a small part of the peroneus longus tendon. Okay, this is peroneus longus tendon. Then here we can identify extensor digitorum, longus. So extensor digitorum longus, it is also a muscle of anterior compartment of the leg, and which is extending down and passing between beneath the superior extensor retinacula and inferior extensor retinacula. Okay, that is also I'm going to show. Before that, let me show you this peroneus brevis. This is peroneus brevis, and here you can see that peroneus longus. And this is the muscle which is present at the dorsal aspect of the foot called as extensor digitorum brevis. Extensor digitorum brevis. So that is about the muscles which we can identify in the dorsal aspect of the foot. Now the fibrous sheets, here you can see that superior extensor retinacula. So this structure may be pinned and ask you to identify what are the structures running beneath the superior extensor retinacula. Then here you can see the inferior extensor retinacula. It is a Y-shaped band actually. So as I have taken the picture has been taken from the lateral aspect, so we could not see clearly the two bands of inferior extensor retinacula. So this is inferior extensor retinacula. Same question they may ask, what are the structures passing beneath this fibrous sheet? Then laterally you can see the superior peroneal retinacula and inferior peroneal retinacula. This is inferior peroneal retinacula. Okay, those two peroneus longus and brevis muscles which are running underneath the superior and inferior peroneal retinacula. Then medial aspect of the medial aspect of the foot, where we can identify another fibrous sheet called as flexor retinacula. Flexor retinacula. So what are the structures passing beneath the flexor retinacula? You can easily identify this is tibialis posterior, and this is flexor hallucis longus, and you can see some vessels and nerves also. Vessels and nerves. So the vessels are called as posterior tibial artery and the vena comittentis, and the tibial nerve which is passing beneath this flexor retinacula. So that is about the questions usually asked in the practical examinations under spotters. So in the next class, we are going to discuss about the viscera in the thorax and viscera in the abdomen. So viscera, regarding the viscera, how they usually ask the question, that we are going to discuss in the next session.